Hi guys, I'm going to talk today about something that's quite important when it comes to breast augmentation surgery, and that is managing patient expectations, with particular reference to weight fluctuations after cosmetic surgery. It's very important to understand this concept. As I said, we want to manage your expectations. The first thing is pregnancy. I ask all my patients, are you planning on having kids? When are you planning on having kids? And making the patient understand that pregnancy can affect the aesthetic outcome of the procedure. For instance, this is a patient of my own. This is her result 1 year post-operatively. She had a very nice cosmetic result. I then didn't see her for about 6 years. And she had 2 kids, and you can see that the whole breast or the whole chest has literally just dropped down. Fortunately, this can be corrected with a revision, replace the implants, and did a mastopexy or breast lift. Here's another patient. I said, are you going to have another child? No, doctor, I'm not going to have another child. Unfortunately, she did have another baby, and you can see the effects of the pregnancy with the stretch marks that have occurred. This is quite common in a patient that's had quite large implants and then has fallen pregnant quite soon after having the pregnancy. And then you get the weight loss patient, or patients that have lost weight after the surgery. This can either present as a patient where the whole breast is almost detached from the breast, and often these patients complain that when they lean forward, it feels like the implant is detaching from the implant. Fortunately, this can be corrected as well. I ensure that the patient's weight is nice and stable, and this is her result after revision surgery with a mastopexy by removing some of that stretched skin. This is a patient that presented to me with what we call a waterfall deformity after weight loss, where the implant itself is stuck in its position. Particularly, we see this in textured implants. And this is her result 6 weeks after revision. She then fluctuated weight after the surgery with me as well, and you can see the stretching of the lower pole, and also the scarring can also become worse with time and stretch. We had to take her back to surgery, revise the entire lift, and you can see we've restored the scars back to how they were. And if you had to compare her result after the original revision to after my second revision, the scarring now looks the same. Then you have the weight gain patient, so patients that have gained weight after the surgery. So the patient 1 year post-operatively, this was 10 years ago, and then she presented about 10 years later, and this is her. You can see how the breasts have increased in size. I've placed a smaller implant, and I've reduced the breast to improve the aesthetics of the breast. And then you get the low body fat patients. I spend a lot of time with these patients. If you have a very low body fat, it does put you at a slightly higher risk of requiring revision surgery. The reason being is that these patients tend to have very thin skin. They don't have a very good support structure because the body fat is quite low. This particular patient dropped quite quickly, and let me just show you. So it's 6 weeks, 6 months, and then 1 year later, you can see how much the breast has dropped. And these patients, if they do want the breast to go back up, we would need to do a mastopexy or breast lift. So another patient, this is fortunately not a common complication, but a complication that is more common in the patient with low body fat, and we call that bottoming out, and that's where the implant tends to drop down actually into the abdominal tissue. Fortunately, this can be corrected. When this patient came to me, we literally did an inframammary fold reconstruction to improve the aesthetics of the breast. And just to show you a side angle, you can see that the scar has ridden up, and that is correction by doing inframammary fold reconstruction. And yeah, just to advise you guys that this is not an operation that's going to last forever. You are going to get older. And if you fluctuate with your weight, either gaining the weight or lose weight, revision surgery may be required if you want to maintain that nice aesthetic from the original procedure. Thanks for watching.